Hi, this is Eva of Eve, and my name is Evelyn. Thanks for watching. Today, we're going to talk about how to utilize lifestyle modification to control high blood pressure. Personally, I come from a family with history of high blood pressure from my mother's side and also from my father's side. So genetically, I am a high risk because one of the risk factor for high blood pressure would be genetics. So this is why this is very personal to me and I really want to talk about it. So while I cannot control where I come from or who gave birth to me genetically, but there are other risk factors and lifestyle modification that I can control, which are within my limits in order for me to control my blood pressure. So as you can see from this diagram, that was beautifully done by my daughter, you will notice that these risk factors contribute to high blood pressure. Things like smoking, high salt intake, high alcohol consumption, stress, bad diet in general, no physical activity or just minimal physical activity, weight gain, all of that contribute to high blood pressure. Think for a second. If you were to remove one of this risk factor out of this equation, you will see how that will reflect on your blood pressure, really. Because we were not born with this blood pressure, really, or if you were genetically predisposed, but you got here for a reason, right? You had all these risk factors surrounding you, and that's how this blood pressure really developed. And in order to fix it, it's not going to be something that we can do in one day. But at least if you can minimize any of this risk factor, like for example, let's go with the bad diet for a second. If you were to limit saturated fats, added sugar, increase salt intake, and you substitute it with more vegetable, more fruit, more whole grain, more fat-free dairies, more lean protein, it is called DASH diets, dietary approach to treating hypertension. Those are the kind of diet that you need to treat blood pressure. Can you imagine how that will reflect on how much your blood pressure is going to be? Or even just, for example, increase your physical activity, such as working out, maybe at least 30 minutes a day. That will really reflect on your blood pressure being optimal. So when you look at all of this risk factor or even minimize smoking, alcohol intake, those kinds of things, or like working out to reduce your weight, so that might actually reflect on normalizing your blood pressure. So lifestyle modification is really important. Not that I'm saying that you can change your blood pressure right away. It's going to be a slow process. Just minimizing all of this risk factor will actually help. And also another thing I wanted to point out is that if you're already diagnosed with high blood pressure, or possibly you are on taking medication, and you notice that the higher blood pressure is, the doctor is going to put you on higher dose of medication. Let's say you are on amlodipine. So if your blood pressure is not controlled with a specific dose, your doctor is it's forced to increase the dose. Can you imagine, the higher the dose, the higher the workload that you're putting on the kidney, because the kidney is what metabolizes medication. So if you were to change any of this risk factor, like I just mentioned, you can imagine, even though you're still taking your blood pressure pills, at least you're not on a higher dose, which would actually even help the kidney do less work, and it will actually prolong your kidney to live a long, healthy life. Health is wealth. Take care of yourself. Take care of you. And thank you for watching. Have a nice day.